in the United States can do an A1C and come up with a very good A1C reading. 6.5 and higher is diabetes. If they're right at 6.5, we tell patients that they should have, and we tell physicians, healthcare providers, that they should have. Somebody has the great idea in the intensive care unit or in the emergency room to get an A1C. And that's when they get discovered that they had diabetes. How long? Who knows? Onset of diabetes, and it goes all the way up. And the first thing we're going to talk about is insulin resistance. And you see how it starts inching up over...
Esse estava Dr. Frank LaVernia, é a founder e medical director para Broward Diabetes Center aí na Pompano Beach, Florida. Dr. Frank LaVernia biriba a invitação de Boehringer Ingelheim para assinar uma apresentação na Tour Doctor e Tour Sinanco da de cerca com o paciente. Tópico de sua apresentação estava a complicação de diabetes tipo 2. Diabetes tipo 2 é o mais comum de amaleza aqui, com porcentaje que varia entre 90 para 95%, representando, na nível mundial, uma quantidade de 382 milhões de pacientes afetados com diabetes, imponendo peso financeiro riba salubridade pública globalmente. Aqui na Aruba, mesmo custo. De seguinte rato, nós também conversar de manejo de diabetes tipo 2, prazer para conversar com o Dr. Frank LaVernia.
So thank you for having me here, Tavita. So what happens is about 80-85% of our patients with diabetes, type 2 adult onset diabetes, their big problem is they're overweight or they're obese. So we try to have them lose weight. They don't have to lose significant weight, maybe 6 to 10% of their weight, slowly with exercise as well as eating better. And eating better is usually just portion control. After that, we immediately, once they get diagnosed with diabetes, we start them on medication. Patients don't like medications. They rather do natural things. And this is very common on the islands, in the Caribbean islands. As I go in different islands, they always say, well, there's somebody that's giving me this natural medication, and it really doesn't do anything. So we have to convince the patients that the importance of taking their medication and adhering to it, not just taking it for 6 weeks and then stopping.
Hopi biata nós como gente mueta esnan ku hopi bia que baja liye de peso, nós que sigue come, nós que pratica pouco, agora tem evento especial, nós que drenta de vestir bonita e com nossa compra, hopi tempo passar com a nota sirve nos mais. Per effetto aqui de subir, baja, crash diets, come pouco, fora dita diable base, e nota bom prática para nossa saúde. Escuta a opinião de Dr. LaVernia Ribesaki.
There is no particular diabetes diet. It's about losing weight and keeping it off. Anybody can lose weight with any kind of diet, but the deal is, can they keep it off? And that's the hard part. So they have to continue exercising, and they have to continue eating less.
Nossa luta tem nos mãos, nós é responsável para de maneira aqui por ter uma comunidade mais saudável. Pacientes de diabetes tipo 2 não são exceção.
If the patient doesn't buy into actually taking care of themselves, it's not going to happen. So one of the most frustrating things I can do with patients is saying, here's the road that you should take, but they have to buy into it. I can write prescriptions. If they don't take the medication, they're not going to help themselves. And it's a very frustrating disease for the patient because it's 24/7. 24 hours, 7 days a week, they have the disease. So it's a very tough chronic disease. And we have to convince patients to buy into it, that they have this disorder that needs to be treated 24/7 for the rest of their life.
If it's an adult, that goes much easier. But what we see nowadays more are young adults.
Right.
Kids from 12 and 11, 12 years with diabetes.
Yeah, so we're talking about two different groups. Type 1 is the juvenile onset that requires insulin right from the get-go. And type 2 young kids we're seeing in the United States where they become obese at a young age and they start having adult onset diabetes. And these kids don't live a long time. They might die when they're 40, 45. So we have to convince the parents, the pediatricians, to signal these people out and tell them it's time you need to have your child lose weight because it's not healthy. They don't grow out of that obesity when they start getting older. They just continue getting bigger and bigger and they become obese adults. You can, if they're in a pre-diabetic state, you can prevent them from going on to diabetes. But most people, 50% of them, when they're pre-diabetic and we identify them, they go on to diabetes.
Boehringer Ingelheim é uma companhia medicinal que compreende a necessidade constante de investigar e desarrollar medicamentos novos, desenhados especialmente para oferecer redução do nível de açúcar em sangue para término largo. Trajanta porta uma alternativa.
There's different medications. We have 13 classes of drugs. And the one you just mentioned is within one class. Okay? So initially we start with a drug called metformin. It's very cheap, very available. If their A1C, their 90-day average blood glucose, does not come under control, then we have to add a second agent. There are actually five agents that you can choose from. This DPP-4, Trajenta, that you just mentioned, is one of the five choices. I'm really hoping that we're going to show the physicians on the island today the importance of taking care of this very expensive disease, because once they start having the complications, it becomes very expensive for insurance, be it governmental or private insurance, and it's very detrimental to the care of these patients. You don't want them to advance to the point where they have serious complications because of diabetes.
Hobby interessante, no? Lo qual Dr. Frank Lavernia trece dilanti, después de propaganda, nos também tem outro tópico interessante, antopa Isaki, nos está conversando com Dr. Cheng, cardiólogo aqui na Aruba.